Thanks for joining us for This Week in Jacksonville Business Edition. Very excited about today's episode. Our guest is Able Medical Group CEO Peter Jensen. He told me I could call him Pete. So Pete, tell us how this is different. This is kind of unique as I've been reading through what Able Medical Group is.
Yeah, so Able is the brainchild of something we've been working on for the last couple years. And really what we wanted to do is solve the problem when folks go to the doctor, right? Especially in kind of a traditional insurance-based environment. You find that you get very little time with the physician. You often don't get many questions answered. It's a very consolidated experience. And so we saw an opportunity to work with some just incredible doctors in the area to put together a different practice that said, let's give patients back that relationship with their physician. Let's give them time with their doctors. Let's give them the ability to understand their health more holistically and give them the opportunity to kind of progress relationally with their physician over time. So that builds a relationship and that builds ultimately better health.
How is this accomplished? Because this is the thing as consumers, as patients,
yeah,
that we're looking for. Hey, I've got a doctor that I really like, but have a hard time getting into. Or when I do need to get in soon, boy, it's a little tougher. All of those sorts of things, right?
Yeah, and there's a couple ways to look at it. So we are part of this direct pay movement, right? Where physicians are kind of going back to the idea where you pay me directly, and I have a set price, and for that I have a much smaller patient population. So where you would look at a physician in a traditional insurance environment maybe has a 6,000 patient panel on the primary care level, our physicians will have 300 to 400 patients at a time. So it's a much, much smaller patient panel. But what that does equivocate to is we have our patients pay us a fee monthly for that access. And
so does this translate to higher costs?
In some cases, what you can often do, though, is look at your insurance environment. And many people, in some ways, may be overinsured a bit, where they have these very, very high-end policies, very low copays. But then the question is always, what are you getting for that copay, right? What are you getting every time you pay that $25? And so what we do with a lot of our patients is we recommend alternatives. Look at insurance plans that are a little bit more catastrophic coverage. Then you get so much money back every month that you can choose to spend where you would like, with the doctors you would like, and keep your costs relatively flat. So especially now in this open enrollment time, you can really consider there are a lot of other pathways to go down, whether it's an insurance plan that's basically there to cover more catastrophic issues and then have a doctor who's really walking with you preventatively to help you avoid some of these chronic illnesses that plague so many people.
The timing may be right because you and we've been trying to get on the schedule for a little while and it hasn't worked out. And here we are, like you mentioned, in November where open enrollment is. And certainly that's something that I think the great HR people are doing when they're talking about benefits. Hey, look at, it might be nice to have a lower deductible, but each month or each paycheck you're paying more. There are ways to look at this that maybe it makes sense to do this direct pay model. Tell me a little bit more about how that process works. And you're not saying to people, don't have insurance.
By no
it's just
means.
Maybe
insurance is an incredibly important thing. But think about what insurance is. Insurance is there for bad things that happen, right? You have insurance when you have a car accident. You have insurance when something happens to your home. With our health, we want to think the same way. You have insurance to help offset the cost when something happens. But so often we treat insurance now as a programmatic thing, something where it's like a subscription, where everything is now kind of covered under that plan. The problem is when the quality of those services declines, then you have to wonder, what are you really getting when all of your kind of interactions with physicians are poor? And so the idea would be, look at insurance as something that does cover you catastrophically, and then get that savings back, and then you choose the doctor that you'd like. You choose the environment that you like. And one thing that it really solves is, when we started the practice, we really wanted to solve two things. One was the relationship factor, but two was the understanding that many years ago, most physician interactions were around like acute issues. You break your arm, you get a bacterial infection.
I'm having a crisis.
I'm having a crisis. Now, so many of us are affected by these chronic illnesses, heart disease, metabolic disease, diabetes, those types of things. And those have risk factors that start years, if not decades, before the conditions truly develop. And that's not really addressed in the medical environment right now. But what we look to do, and what many of these direct pay practices do, is it's much more preventative. We look at these risk factors much earlier. We look at a whole host of biomarkers, and we do much deeper assessments to give folks a better picture of, hey, tomorrow you don't have a problem, but months, years, decades down the road, you are at risk for these things. So here are some nutritional changes, here are some lifestyle, movement changes, stress, sleep. We try to look at the whole picture. And when your doctor has a lot of time to spend with you, he can walk you through those issues in much more detail.
So, as I understand it, you guys just launched here this last summer.
Yeah.
So how many patients are you having so far? What's the plan? Is there expansion coming, or hey, we need to get settled here to start in this first year of operations? How do you plan that?
We're just working through just making sure the patient experience is top notch, and that's our main focus. We've had a good run of patients coming in. We've had a really good response in the first few months, and the patients have universally really enjoyed the experience. It's been really great, but it's also been a learning opportunity for us as doctors settle in and understand exactly what the patients see value-wise as they kind of move through the process. They can really dial in what we're offering, how we give, how we deliver care, and really make sure each patient gets what they need. Our patients really enjoy, again, in a lot of direct primary care practices do this. They have direct access to their physicians, so they can text with their doctor directly without having to go through appointments or things like that. They also have the benefit of getting their own personalized health plans, and so we've been dialing those things in and making sure that access is what we promise.
Yeah, that's not necessarily the case with many of the physicians' offices that are here in town.
No, that's where we try to
I go
differentiate.
through a portal.
Yeah.
I've got a gatekeeper, I've got a nurse to talk to, all those sorts of things.
Oh, for
But
sure.
I think that makes sense, considering what you said, is that their patient portfolio might be a few thousand rather than a few hundred.
It's just a different way of care. We look at it as for the patients that it makes sense for, you can come into an environment where your doctor has much fewer folks to focus on, so they can put much more attention on you. And for some folks who value that, it's worth the price.
All right. Peter Jensen, I want you to tell me about kind of the process here. I've read through some of this. There are, I guess, some things in the process that help a patient begin this journey to be preventive care rather than this crisis care or acute
Yeah,
care.
absolutely. So every patient that comes in with us, they'll go through a consult, and that's basically just meeting the physician, making sure it's a good fit for them, making sure they understand the process. From there, we do in-home labs. So we have a phlebotomist that comes to your home. They'll do your lab draws right there, so there's no going to a Quest or someplace like that and waiting in line. We try to make it a very comfortable experience. Those labs go much deeper. We look at a whole host of hormonal and cardiac markers and all types of things to really get a good picture of our patients. And we couple that with a really deep family history and what we call a functional movement assessment. And I think we're the only ones in North Florida doing this, where we run our patients through a test for things like VO2 max, which is a measure of aerobic capacity, stability, strength, and we metric them on really, really good data that shows, hey, if you are on these categories from a strength, stability, aerobic capacity, your risk of developing many of these chronic conditions is much lower. And so we have practice targets, and so we'll map our patients to those practice goals and say, hey, you're right there, you're doing really good, let's keep you there, or hey, there's some room for opportunity here, let's work on a workout plan or some movement plans to get you moving there, so as you age, as you get into your 60s and your 70s, you'll do that much more, in a much healthier fashion, and you'll lower your risks for some of these conditions.
So let's talk about this, because it's not just adult care, pediatric care as well. So who is this really targeted? Is there a certain age range?
Yeah, the pediatrics program is a bit different. So the idea for pediatrics is really helping establish these healthy behaviors from day one, right? And so it's the same basic concept. You have a pediatrician where when your kids are sick or ill or having issues, they're there for you. Our pediatrician will come to the home. They'll do, strep tests. They'll check you out for ear infections, things like that. So you don't have to go into the office. Or more often, what we see a lot with our patients on the pediatric side, they can't get into their pediatrician for a sick visit. So they'll go to urgent care or something else that they don't really feel comfortable with. So our doctors will come to the house, they'll do the tests, they'll run things like that.
House calls.
Yeah, we do house calls on the pediatric side, yeah.
Okay.
And that's gone really well. Our parents really love that. Our intakes are actually in the home too. And so Dr. Chima will come out to the home. He'll run through everything for about 2 hours with mom, run through, vaccination options, look at everything from a health and wellness perspective. And each kid gets that same thing. They get that health plan that helps mom understand how are they doing nutritionally. Because the goal is, if we can help set parents and kids up with healthy habits in the beginning, those kids will carry them into adulthood.
Yeah. Where'd the idea come from? And you just mentioned a couple of the doctors, but you said, hey, we've got a couple of great physicians that are helping make this happen. Is your background medical?
Not at all. No. In full transparency, I'm a business person. I've got a few other businesses in the background, but this was the brainchild of a few years ago with my own health journey, running into some real problems and just hitting a wall in the healthcare system, going in to see my primary care, getting very, very few minutes of time and a very cursory look and just saying you're fine and kicked out the door.
That's frustrating.
Yeah, and so, you know, I walked away from that saying there's got to be a better way. There's got to be a way where I can have a relationship with a doctor, and to find that that was a really limited option here in North Florida. You see it in other places. You see these concierge practices more prominently in other areas, but it seemed to be a limited resource here in Jacksonville. And so that's what prompted the idea to do some research, see what some of these other places around the country were doing, and then look to start something here that offered that same service.
So tell me about the broader market here. This is something that happens other places in the country? Is this a standalone, the first of its kind in Northeast Florida?
No, there's absolutely other practices doing it. I think the difference is, you know, we're looking to kind of standardize a model. I think everyone does it a little bit differently. A lot of times these are single physician practices or kind of remote practices. And so our goal is to provide a bit more structure around it. And so what we've done, especially in the first year with our physicians, is to build a model of care with a lot of practice standards and goals for patients. So we can really help our patients develop a really high standard of goals and progress to really prevent a lot of these chronic illnesses that develop. And so I think one of the things we try to differentiate on is we do a much deeper dive when we intake a patient than you'd find in most places. And then we also have a lot of practice standards that really allow us to do goal setting with our patients. Things like longevity risk assessments and health plans really set a framework for people to understand where they land on their overall risk factors. And so we structure it that way.
If I'm comparing to or thinking about, hey, I've got my company's health insurance plan and I want to consider this direct care model. What are costs like? I know I'm paying hundreds of dollars per paycheck for the family coverage plan in my HR department's benefits model.
No, for sure.
What should I be thinking about with something like that?
Yeah, you know, our plans start around $300 a month, and that is full unlimited access to your physician. That includes the labs, the functional movement assessment. It includes kind of everything in our portfolio of practice. I believe next year we're looking at how the law will settle out, but it should allow for HSA funds. So next year HSA funds should be usable for concierge practices like us, and so the goal is to accept that. But again, we always really look at it in the idea of offsets. If you're someone who's really invested in your health, we're a good pathway to offer an additional layer of support and security to help you on that health journey. And again, also as you look at your insurance renewals, especially if you're self-employed or a private business owner, there's lots that can be done to kind of offset those costs and move it around.
Yeah. Pete, what does it look like since the summer and the launch? And then what does it look like for you in 2026 as you get closer and closer to the new year? Yeah,
you know, I think we're really finding our feet right now. It's been great helping, you know, working with the physicians. Every week we have our meeting and we look at, you know, how has patient feedback been this week? How have the new patients that onboarded, how has their experience been? And those metrics have been really positive. It's been really interesting to see. And so we're looking at the holiday season closeout, just making sure we, you know, intake the patients we have on the waiting list right now, and that's a good process for them. And then the focus on 26 is really growth, adding a couple physicians. I'd love to focus on women's health and get a women's health specialist in and look for some of these other specialties where we can add value to our patient experience with some of these other unique areas. We're also bringing in a focused functional movements trainer so that someone can come and really help dedicate time and training support. We found patients like some of the direction, but they want even more support. What exercises should I be doing? What's a good workout plan for me? So finding a workout, like a trainer environment that's not just about bodybuilding or something, but really geared toward longevity from a training perspective is a big focus we're going to be looking at in 26 as well.
And as I understand it, that really comes down, a lot of that is flexibility.
100%.
Right? Those two things are a huge factor.
But you know, one of the key metrics, the metric that is more directional than any other out there is actually just VO2 max, the measure of aerobic capacity. That one measure, if you're in the top 25th percentile for your age as opposed to the bottom 25th percentile, gives you a 300% reduction in all-cause mortality. So dying of anything, you are 300% less likely if you're in the top 25th percentile as opposed to the bottom. It's an incredible metric. It's very directional, and it's because it measures a combination of things. It measures a lot of work and energy building up your overall aerobic capacity and strength. Everything feeds into that one metric, so we really look at VO2 max as a very directional item for our patients.
It's gone well enough for you that you're pretty optimistic about what's happening in 2026.
You know,
right?
I think this is the way medicine's going to go for a lot of folks. In my personal belief, I think insurance-based care is continuing to struggle with the influx of people. Doctors are overwhelmed. We talk to doctors every day who want to come over to our practice, and the thing I hear every day is, I have too many patients. I can't spend any time with them. This isn't what I signed up for when I went to med school. And they see this as kind of the old school way of, a little bit more of, I've got enough time to spend with these patients to make a difference in their lives, and that's what doctors love. So I see it from both sides. I see us as having the opportunity to create an environment where physicians get to be doctors again and then deliver a really great product to the patients.
Is there the potential, this is like industry-wide, but is there the potential that more physicians come to this kind of model, and then even more we feel the lack of the right number of physicians in that more traditional model, I guess?
Yeah, I think that's always a challenge, right? As the industry shift around, like when you see doctors moving, it's basic math. If a doctor's seeing 6,000 patients and they move to seeing 600 patients, that's a reduction in capacity. And I think that's absolutely something the medical community at large is going to have to tackle. It's a true and challenging problem. And I think, too, the insurance model really affects that, right? As insurance rates continue to go up and up and up and up, and the quality of care goes down and down, something has to break, something has to change. And I think so much of that comes back to that sick care versus preventative care model, right? Where if we can get more people to understand these chronic conditions that are really what weighs down the medical system and avoid them early on, then you can reduce the burden on the medical system for these folks later in life. And I think that's really got to be the goal.
Where is how many locations? One location?
One location, so Ponte Vedra, right there, by Ruth's Chris, kind of in that area. That's where we launched. We're looking at other spots around town to be more accessible as we grow in 26 and 27. Yeah.
Able Medical Group just launched this last year. The CEO, Peter Jensen, our guest today. Thank you so much, Pete. I appreciate it. Thank you for explaining all of this and where you guys are going. And thank you for watching and listening. Remember, wherever you find this podcast, go ahead and like, follow, and subscribe. New episodes of This Week in Jacksonville Business Edition come out every Thursday.